So during your exam, you must know about insulin. They will ask you about onset time, peak time, or duration. So onset means how long it's gonna take to show its effect. When is the last time? When it's gonna be in peak time? This is a time when patient develop hypoglycemia. So you must know about peak time and how long it stays in your system. So you must know about this onset, peak, and duration. So let me teach you a technique where you will remember your onset, peak, and duration time. So there are 4 types of insulin that you need to know. First is rapid. So you always need to know their onset, peak, and duration. So during your question, they will ask either one of this. What is the onset? What is the peak time? What is the duration? So just consider this. Rapid means very fast day. Just consider this as a that you are working on Monday. New day, beginning of the week, Monday you are working, and it is very fast day. As you know, this is rapid means fast. So consider this as a that you are working on Monday. So the trick is onset, peak, and duration. So somebody come to you, your admission lady come to you, and she will inform you that hey, your admission is coming in 15 minutes. So admission coming in 15 minutes. So now when you find out that your admission is coming, you are panic condition. Your heart is pounding and you're wondering why admission is coming in my shift. So now you are keep looking at the door if the ambulance is parked or not. So now you can say it's been 1 hour, still no admission. And finally, your shift is about to an end and the admission is still not here. As you are giving report, you see the admission is coming in. So you can tell your incoming nurse, after 3 hours of wait, finally admission is here. So that would be your onset, peak, and duration. So onset is 15 minutes. When the admission lady or admission people tell you, hey, your admission is coming in 15 minutes. So you have to remember this way. Now it's been 1 hour, still no admission. So that is your peak time. And after 3 hours of wait, finally admission is here. But you are happy that you're going home. So 15 minutes, 1 hour, 3 hours, that is your peak time. Onset, peak, and duration. Now let's discuss about short acting insulin. So now consider this that you are working on Tuesday, Monday, Tuesday, next day, and you will find out that you have a new orientee that is going to follow you. So you also have orientee with you. Now orientee asks, so you need to know this. Now write it down again. Onset, peak, and duration. So when orientee asks you, so how many patients do you have? So now what are you gonna say? We have a 30 patients. We have with 2 nurses during our 8 hour of shift. Once again, the orientee asks you, how many patients do you have? So you will say, we have a 30 patient with 2 nurses during our 8 hour of shift. So onset is 30 minutes, peak is 2 minutes, and duration is 8 hours. That's how you're gonna remember this. Now third one is intermediate. And now Monday, Tuesday, intermediate means middle of the week. So now just think that you're working on Wednesday. Onset, peak, duration. So onset, again you have 2 nurses, same like before. You have 2 nurses on the floor during your 8 hours of shift, and your manager asks you, can you do double? So you agree to stay double. So that's mean that day on Wednesday you are doing double shift, 16 hours double shift. So on Wednesday you also have 2 nurses, peak time 8 hours and duration 16 hours. So onset is 2 hours. 2 hours, 8 hours, 16 hours. Remember this way. Lastly is long acting. Just think, so you work Monday, Tuesday, Wednesday. Now you are off on Thursday and Friday, and that is Saturday. Slow day, that is slow day. You know, on Saturday there is no staff member, no manager, so that would be your slow day. So onset, peak, and duration. So in this one, onset, again you have 2 nurses, peak time, no CNA. You are working with no CNA today, or 0 peak. That's mean no CNA. The reason is there is no CNA because of always short staff. The CNA, they are on strike from last 24 hours. On strike. So that's how you will know. So review few times, you will know it. So long acting is a 2 hours onset. There is no peak time and duration is 24 hours. So during your Nclex exam, you must know these 4 types of insulin. You will get a lot of questions from these notes. So go over, read 1, 2 or few times to know everything about it. So first is rapid. Here's a generic name. They will mostly ask you generic name. They will give you about these names. A patient is taking aspart, a patient is taking lispro, a patient is taking glucosamine. You have to know about generic name. And other side is a brand name, also known as Humalog, Novolog or Apidra. All the logs are rapid medication, rapid insulin. Think about lispro. Lispro means let's go. So that's mean let's go quickly, fast. Aspart mean move your ass quickly, so fast. Glucine, glue dry fast. So it's also fast acting medication, insulin. So that is the highest risk for hypoglycemia. So when you give this to patient, that's the most famous for hypoglycemia. You have to watch it, and must have meal within 15 minutes or right before meal. So they will ask you question about this medication. So you have to choose. Patient must have meal within 15 minutes, or the patient food tray just deliver and the nurse can give this medication right before meal tray. Next one is short acting. This is regular. Also another name is Humulin R and Novolin R. You will see on the bottle. and this short acting is the only can given via IV line, and this is also given in emergency like DK via IV. So regular means right, just remember right goes to right vein. This can given in same syringe with NPH. This is the only medication can also given with in same syringe with NPH insulin, and also can be given in different syringe with long acting. So you must know this. Next one is intermediate, also known as NPH. So insulin and NPH can be given in same syringe. Another name for this is Humulin N and Novolin N. So this is Humulin R, Novolin R, this is N for NPH. This is not clear, but it's cloudy medication. Can mix with regular insulin. When you're mixing this, clear first, then cloudy. Think RN. So regular you have to draw first, then cloudy. Clear, then cloudy. And the last is long acting medication, long acting, another name Glargine, Determine, and Degludec. Also known another name is Lantus, Levemir, and Tresiba. So this one, do not mix with any insulin. It has no peak time and has steady release throughout the day. Give same day or same time for consistent control. So you must know all 4 types of insulin. Read this note one more time, and by reading this you will be able to crack a lot of answers. Which one to give via IV, which one you draw, and so on. And in my another video I will discuss about, you must also need to know about onset, peak, and duration time. They will ask you a lot of questions about that thing as well. So on my second video I will make that one as well.